Okay, so this is communication with patient and family.
Mhm.
I'm starting your 2 minute, only one slide.
Okay.
Dr. Fakia, I have started your
Mhm.
10 minutes.
Okay. Hello, I'm Fakia, one of the registrars in the District General Hospital. May I confirm your name and age, please?
I'm Angela. I'm 25-year-old.
Is it okay to call you Angela, please?
Yeah, yeah, it's okay, doctor.
Mhm. Angela, from the information I can see that you are here because you're not having periods for the last 12 months and you have some concerns related to it and to know the plan of management. Any other concerns you have, Angela, from this consultation?
Yeah, doctor, I'm just worried because my periods are not there, and at the same time, I'm worried
Mhm.
will it affect my future fertility? Although I am not in any relationship, but that is worrying me a lot.
Your concerns are quite valid, Angela. I will be answering all your questions and concerns, and together we'll reach to a mutually agreed plan.
Hmm?
But before that, do you want to add to your concerns, please?
Yeah, that is my concerns basically.
Okay, okay, that's fine. So, did you have any previous problems with your periods?
Yeah, prior to this, also my periods were actually regular. They used to come every 2 to 3 monthly, but at
Mm-hmm,
least I used to get it. But
mm-hmm.
since last 12 months, I haven't got a single
Uh-huh.
period, doctor.
I'm really sorry. I'm really sorry. I understand that you are quite stressed about it. Do you want any counselor to be attached or?
No, I'm not stressed about it, but I just wanted to know.
Uh-huh, that's fine. Okay, so Angela, did you see a doctor when you had your prolonged periods
Yeah, he
earlier?
has tried some pills also, but to that
Mm-hmm.
also I didn't get it.
Okay, so you are taking pills now.
Yes.
Okay, for how long are you on pills and which pill are you taking at this moment?
I'm not any. Now I am not on pills. I have took
Mm-hmm.
pills for the periods.
Okay, but now you're not taking. Okay. Do you feel like in any acne, any abnormal hair growth on the body?
No,
Mm-hmm. And any sensitivity to the temperature? Like, do you feel excessive cold or hot?
no,
Mm-hmm. Any headache or any problem with the vision?
no,
Any abnormal discharge from the breast, milk discharge?
No, no.
Okay. Few intrusive questions, Angela. Are you sexual? You said that you're not in relationship, but had you been in sexual relationship in the recent
Yeah,
past?
not in the recent past,
Okay.
but
I just
I had been in a relationship long back.
okay. Just wanted to make out that you're not pregnant. That is why I was asking. Like
No, yeah, no, 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 no.
not pregnant. You're sure about that. Okay, that's fine. And um, just want to ask you any intended or unintended significant weight loss you have had in the recent past?
Intended doctor, yeah, doctor, because see, I'm a hairdresser. I'm into this fashion industry. I need to be
Mm-hmm.
very fit. I need to be
Mm-hmm.
very fit. So
Okay.
even I am losing, but I still think I need to lose certain weight. As of now, I
Mm-hmm.
am 165 centimeter in height and 48 kilogram is in my weight. But I'm
Mm-hmm.
working on it to decrease a little bit more also. I
Okay.
should be
So
at least 45 and less.
okay. So like how much you must have lost over this period of time?
Uh, I am losing it since last 1 year, 1.5 years. So yeah, it was a gradual process. So
Mm-hmm.
now I am 48.
Okay. And what about your diet? Like, are you
Yes,
dieting
sorry.
as well? Or you do excessive
Yeah,
exercise
yeah,
only?
yeah. Yeah, I am doing exercise. I'm very particular about my diet. I don't take any extra calories.
Mm-hmm. I understand where are you coming from. Okay. Any other medical conditions you're known to have, Angela?
No,
Mm-hmm. Any allergies you have?
no.
Okay. And how's the support at home?
As of now, I'm staying all alone because I have been migrated. My parents are at countryside, so
Mm-hmm.
I'm emotionally fit and fine.
Okay, that's good to know. And did you receive the call for cervical smear?
Yeah, I have been attending that.
Okay, that's really good. Anything else you want to add?
No, that's it, doctor.
Okay,
I
thank you
just
for
wanted
the
to know what
information.
is wrong with me and when I'm
Yeah,
going to get my periods.
yeah. Thank you for the information. Is it okay if I examine you in the presence of a chaperone and I'll do your head-to-toe examination and my nurse will take your observations? Is that okay with you, Angela?
Yeah, it's okay, doctor.
Mhm. So now coming to your concerns, Angela, do you have any idea what is going on? Oh,
I don't know, doctor. I am not aware what's going on.
okay. Sorry. So this condition basically happens when there is imbalance between the energy intake and the expenditure. This condition is called as hypothalamic amenorrhea, or in other words, it is functional hypogonadotropic hypogonadism. Have you ever heard about it? I understand it is quite cumbersome name.
Never, doctor. This seems to be very deadly name.
Yeah, it is basically what happens, as I said, that when the body finds imbalance between the energy it takes and its expenses, like expenditure, as in your case, because you're dieting, doing regular like exercise to like shed some weight, that's why the body, what the body is getting, whatever energy the body is getting, brain is getting, is trying to utilize in the organs which are more vital to the body, like the brain, the heart, and the other organs which are not as important as brain and heart are compromised, like the uterus and ovaries. Does that make sense to you?
Okay.
That this is to shut down or to suppress their activity, like uterus and ovaries activities are being shut down or suppressed to conserve that energy for your brain and heart. Am I clear so far?
Okay.
Okay, so this condition basically, that's why the hormones, the signals coming from the brain to the ovary to release the hormones so that you can have period is suppressed. That's why you are having not having periods for the last 12 months. Am I clear
Okay.
so far?
Yeah, quite clear, doctor.
Mhm. So what I'm going to do, first of all, I need to rule out the other causes of not having periods. So for that, I'm going to send investigations, which will include full blood count to see how is your iron levels. We will check whether thyroid function, because that also is a reason you can not have period for some time. A polycystic ovary needs to be removed, ruled out. So I'll send your pregnancy hormones like FSH, LH, prolactin. Prolactin is one hormone. When it is high in amount, you can have amenorrhea, that is not having periods, right? And your male hormone level needs to be checked. And then your bone density is very important, because if you are not having female hormones, the bone can get weakened. So these all tests we'll perform. Is that okay with you?
Yeah, it's okay, doctor.
Mhm. And then starting your management will involve a team of practitioners, which will include our doctor, consultant gynecologist. We will involve the lifestyle modification clinic, and to have a personalized diet chart plan for you, and also the physiotherapists who can guide you to decrease the amount of exercise, and diet chart plan to give you a plan which can optimize your health as well as your performance. Does that make sense to you?
Okay.
Mhm. And then we will involve the hormone specialist, that is the endocrinologist, and the psychologist is very important, because that also, because with this condition gradually you need a psychotherapy as well.
What do you want to say? That I'm mad, doctor?
No, I'm really sorry if I made you feel that way, but psychological stress that you are planning to get pregnant in future and you're not having periods. So all those things can affect your mental health. That's why it is very important for you to have talking really helps in such situations.
Okay.
Now coming to what we are going to do. I understand that you want to shed some weight, but because shedding weight now is affecting your overall health, okay? So
Hmm.
there has to be a plan, a balance between both these, okay? So if we start following a proper diet chart plan and a reduction in exercise, that will help you balance the energy you get and its expenditure. Gradually, over a period of time, you can start having your periods, right? Am I clear so far?
Yeah.
Mhm. So, if at all it does not help, then we can proceed further and take further help from the hormone doctor as well. But as for now, what we are going to do, we are just trying to change your diet plan and exercise. We will add some, because you need at least 300 to 400 kilocalories for normal body function. So, for that, and we'll have the plan, and also need some vitamin D, calcium. These are very important, and your bone function also is very important. So we'll do the bone density accordingly. We will supplement you with the medication. Now coming to your periods, give you estrogen replacement therapy, because of your heart and your bone also needs support. So estrogen replacement therapy and some progesterone from your like down below the vagina, micronized progesterone, that will cover up the hormonal it will deal with the hormonal problem you're having at this moment.
Okay.
Mhm.
Okay.
So with this, you can attain your periods gradually, and we will see you in. Do you have any questions at this moment?
No, doctor, I'm pretty clear.
Okay, so I'm going to arrange another appointment with my consultant. In the meantime, I'm giving you the written information. You can go through it. If you have any questions, and come back with the questions when the consultant's appointment is there. I'm going to write back to your GP as well, and arranging, talking therapy for you, and also writing back to your GP in detail. In the meantime, Angela, if you have any concerns, like you feel unwell, you are not coping well with the condition, please come back to us. This is the 24/7 number from us.
Okay, doctor.
Okay. Thank you very much, Angela, for your time.
Yeah, thank you. So it's almost 1 minute, 20, 30 seconds extra. Okay. Wonderful presentation. That is what I can say. Anybody would like to comment on her performance? Anybody? Come up, dear, come up. Okay, so I just wanted to tell you where exactly you had lost your timing.
I think I explained a lot about the condition.
Very right, very right. Okay,
Yeah,
I'm
yeah.
having a very simple explanation how to explain
Mm.
it.
Yeah, ma'am.
Okay. So because that energy less, energy excess, it might be going haywire on a role player as well as lay. Most of the time in such situations, the lay examiner will be there. And this is actually communication with patient and family domain. So lay will be expected. You can expect a lay here also. So
Mm-hmm.
those explanation were actually you were not able to explain me in a desired
Mm-hmm.
way. Okay. So there exactly you had lost the time. Otherwise, there
Mm-hmm.
is hardly anything where I could have said means where I need to tell you that okay, this was missed, this was that. Okay, it is
Mm-hmm.
perfectly according to my answer key. So without less
Mm-hmm.
wasting time, let's go through the answer key. Okay.
Mm-hmm.
So my answer key is introduction, confirm the aim of the consultation, a amenorrhea of 12 months, setting agenda. You actually forgot to ask. So before discussing, before going into the details, may I ask you a few questions? So that question is setting agenda. What exactly we are going to do? Okay. Then we will discuss the care plan. Okay. So that was missed out. So please ensure that you will not be missing out. Your history taking was well within time. That means 4 minutes 45 seconds. So you can still minimize that history taking. Okay.
Mm-hmm.
Relevant history only you took regarding the differential diagnosis of amenorrhea, current menstrual history, previous menstrual history, smear history, medication, progesterone you asked, previous cycles you asked, PCOD history you asked, prolactinemia history you asked, thyroid disorder history you asked. This history was missed out. Hot flushes,
Mm.
palpitation, vaginal dryness, and even
Yeah.
sexual desire. Okay. Okay, so that you
Mm-hmm.
have you need to. It's okay, but I'm not penalizing you for that. You just need
Mm.
to take out you just need to have that differential diagnosis, at least two or three differential diagnosis history you need
Mm.
to ask. Okay,
Mm-hmm.
but see to it you will cover at least POI is another differential diagnosis when the periods are not there. Urine pregnancy test and sexual history you asked. Stress and weight loss history you could able to elicit it very nicely from me. Occupation you forgotten. Okay,
Mm-hmm.
then
You told me that you were
okay. No,
yeah,
I told
performed.
you,
Yeah.
but I told you when wanted to explain you that why I am decreasing the weight. Okay.
Okay,
So
okay.
then it is
Mm-hmm.
not history taking. Then it is not
Okay.
history eliciting. Okay.
Okay,
So
okay, okay.
I'm losing a weight. So if I would not have said why I'm losing weight, you could have asked why you are keen on reducing weight. Then I will
Yes.
definitely come out that okay, I'm into the fashion industry and all those things. Then
Mm-hmm.
signposted me, asked me regarding sexual history, but dryness also and desire also is one history.
Okay,
Hmm?
ma'am.
Yeah.
Mm-hmm.
Difficulties, desire, dryness, contraception, smear, STI. STI is important. Why actually? Why? I generally do
Um,
not
yeah, I
involve.
intentionally did not ask. I thought it is not
Here, I no,
important.
it's
Yeah.
okay, it's okay, it's okay. But here I just thought any endometritis.
Mm-hmm.
Yeah,
Yeah.
endometritis. Yeah. So
Yeah.
in surgical
Mm-hmm.
evacuation, any endometritis, STI,
Mm-hmm.
chemoradiotherapy, which has been given in this book. Okay. So that's the reason
Mm-hmm.
chemotherapy, radiotherapy, STI, evacuation. Okay. Just to end organ damage.
Mm-hmm.
We are considering it is hypothalamic, but that end organ damage, that is history is also needed here. Then dietary history, mental history, just rule out
Mm-hmm.
anorexia nervosa. Okay, here you
Mm-hmm.
could have spent some more time because you asked me, I'm taking a diet. Okay, so what are my views regarding the diet? Are you omitting, excessively omitting? Are you taking purgatives? So all those history, because in the RCOG, I think this station is associated with this anorexia nervosa. Okay, so here you
Mm-hmm.
can take some time to ask that dietary history, what are her views, whether she is taking any medications or purgatives or excessive nausea vomiting. Okay, so that history should have been you can include that. Okay,
Mm-hmm.
very short history actually here we are taking. And
Mm-hmm.
if that history coming up in mental history is coming up, then please ensure you will ask history of self harm. In this case, not needed.
Mm-hmm.
Yes, in this case, not needed because I am not having any emotional problems. But I am very
Okay.
particular regarding my diet and I am very particular regarding my existence exercises. Okay, family
Mm-hmm.
history of similar condition you can ask. You offered me overall examination, but I don't think even the book has said that we need to examine her. But here my main concern is my BMI. What is my BMI? And it will definitely less than 18. Okay, so
Mm-hmm.
thank you for sharing all this information. Say in case looking at her case, she is having absent menses mostly because she's having low BMI, absent menses, excessive weight loss, and we call this as a hypothalamic or brain origin or WHO type 1 amenorrhea. Okay, so
Mhm.
I had just tried to mention her in a little simpler way. So, have you heard about it? You had checked my background knowledge very nicely. Now, here I will definitely draw a few goal. That means
Mhm.
round figures, and I will just tell her that this is the
Mhm.
hypothalamus, that is the highest part of your brain, which will,
Mhm.
then there will be another small brain, that is a pituitary organ. Then this means this will signals to your pituitary, this pituitary will signals to your ovary, and this will secrete the hormone which ultimately will lead to menses.
Mhm.
Okay, so this is a uh, normal signaling. Okay, so this normal signaling takes place and we will get a menses.
Mhm.
Okay, so this is my simple way. So this will, and then we will be, but excessive weight loss
Mhm.
is interfere with signaling.
Mhm.
So these signals get hampered, and then
Mhm.
the signal get hampered at the highest level.
Mhm.
Okay, so the simple explanation. This will get hampered at the highest level. So we will be labeling as a hypothalamic, okay,
Mhm.
hypogonadism.
Mhm.
Hypothalamic hypogonadism related
Mhm.
amenorrhea in our
Mhm.
clinical language. So this is a
Okay.
simpler way you can explain. Yes, very nicely you had mentioned that, but we need to rule out by doing certain blood test, other causes like thyroid, pituitary, ovarian, pregnancy. So all those investigation is needed, like urine pregnancy test, USG, hormones like thyroid, prolactin, LH, FSH, pregnancy hormone or estrogen, progesterone, and DEXA scan. Here only you can mention DEXA scan, because DEXA scan is important. The hormone estrogen will be lacking in your case, and it will affect your bone health and your heart health. Okay, so we
Mhm.
need to rule out. We need to identify now. Uh, if you have not taken this history in detail, so here also you can ask in detail about her weight loss. Now what we need to do, you, okay, so advise to moderate her exercise regimen, or she can cut down at present totally on her exercise regimen. Do
Mhm.
not lose further weight.
Mhm.
Okay, so that I need to tell, I need to write it down, weight here. Hmm? So do
Mhm.
not lose further weight, that is my advice to you. Hmm?
Mhm. Mhm.
Because it is detrimental to your health and your bones also.
Mhm.
Okay, so this needs to be signaled and needs to be explained to the patient in a very sensitive way. Okay, so you have to
Mhm.
advise that. Along
Mhm.
with that, it will be a multidisciplinary team approach. Yes, so
Mhm.
gynec consultant, dietitian, mental health professional, counselor, GP, and nutritionist also. Here I had mentioned
Mhm.
nutritionist. Somewhere I had mentioned. Yeah, here I had
Yeah. So
mentioned. And
dietitian is fine. Are okay, dietitian and nutritionist. So they are different.
dietitian is basically they're giving her extra calories, and the
Mhm.
nutritionist will be giving her nutritive measures. There are two
Okay.
different people. These are two different
Uh-huh.
people. Okay,
Okay.
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 And you
Mm.
mentioned about physiotherapist. No, here it will not be a physiotherapist. Okay,
Mm.
somebody
Mhm.
from the sports team member. Okay, if she
Okay.
is okay,
Sport
any
physician
sports team,
basically.
sports physician. Okay, yeah, you can
Yeah.
take the name of sport team member or sports physician. This is
Mhm.
basically that athletic syndrome. No? This is athletic syndrome.
Mm.
So there
Exactly.
they involve the team, means sport team leader.
Uh-huh.
Okay,
Yes.
for
Yeah.
the well-being of that athlete. Okay, so here
Mhm.
also a sports physician also you can mention. Okay, or
Mhm.
gym instructor also you can involve. Means involve
Mhm.
somebody who will be dealing with that. Physiotherapy,
Mhm.
we do not need to give her physiotherapy.
Mhm.
Okay, but she can go ahead with light stretches, light walk. That doesn't mean
Mhm.
she needs to means
No
rigorously
vigorous
exercise.
exercise. Yeah. Yeah.
No vigorous exercise. So that is one thing.
Mhm.
Minimization of exercise along with increasing calorie intake, so that the
Mhm.
targeted BMI will be 20 to 25.
Mhm.
Nutritionist, dietitian will be involved. CBT and talk therapy. Yes.
Mhm.
Uh, Even after losing so much of weight, you feel that if you are means sometimes, because it is you are feeling that your weight is not up to the mark. So
Mhm.
sometimes talking with the means therapist will help you to change your perception about yourself.
Mhm.
Okay, so that
Mhm.
they will help you to come out of this mindset that you are
Mhm.
not fit or you are not looking
Mhm.
nice. So
Mhm.
just to that's the reason. There are support groups also. The people are there who are also on your, means they are also trying to lose excessive weight on this verge, so you can talk with those also. Here you can take a help of those people. One more point I just wanted to tell you, okay, I will tell you. Feedback, okay. And once the targeted weight achieved, okay, once the targeted weight achieved, you will start your period, you will start ovulating, and in future you can get pregnant also on your own without any help. Okay,
Mm-hmm.
that concern you didn't answer.
Mm-hmm.
Okay,
Yeah.
I told you, you had just given me management, but by the end, you had missed out on that totally. But now, the treatment what we are going to give you, because the estrogen is decreased, it will affect your bone health. So, nutritional supplements, mineral, vitamins, calcium, and vitamin D, along with estrogen from outside and progesterone. In any form, progesterone, you just need to take the names. Okay, so these are the medications what we are going to give you for a better bone health. Hmm?
Mm-hmm.
Fertility, we had just mentioned. Okay, now with all these things, I will be closing the loop. Multidisciplinary team approach, arranging investigation, follow up with consultant, counselor, and we will like to communicate with the GP. That's it. Okay, what you mentioned, I told you that I am not getting my periods since last 12 months. So
Mm-hmm.
you thought that I am very disturbed and I need to see the counselor. The
Mm-hmm.
counselor is a part of your treatment, but not that moment, at that
Okay.
moment.
Okay.
Okay, so when you thought, means
Mm-hmm.
once you had completely taken the history, that time, just because I'm
Mm-hmm.
not getting period, that doesn't require a counselor. It could be
Okay.
POI, something like that. Okay, I'm
Okay.
not too
Yeah.
stressed, too stressed out, too
Okay.
stressed out. So there
Mm-hmm.
you could have avoided that. Okay, so this
Mm-hmm.
way we will be completing it totally. Now
Mm-hmm.
coming to the domain wise scoring. So this is very nice figure. Okay, nice. This secondary amenorrhea associated with this excessive weight loss or hypothalamic hypopituitary hypogonadism, amenorrhea. It has been given very nicely. Nothing to do. Okay, so most of the points we had covered from this slide. This is also HH, okay, hypothalamic hypogonadotropy. So LH will be low, means FSH will be low. So sometimes they might give you along with a hidden history, they will give you investigations to diagnose it on the site. Hmm? So
Mm-hmm.
please, this will allow you what kind of means amenorrhea the patient is having. Hmm? Always remember this.
Ma'am,
So
what was HA? HA, what was HA? HP is hypothalamus. What is, I didn't
hypothalamic
get it.
pituitary, HA is I will check it. Okay, I will check it. Uh,
Mhm.
Okay, I will
Uh,
check it. This is from the TOG only, but I will check it.
okay.
Mm,
Hypothalamic hypogonadotropic is first.
yeah.
HH.
And
Mhm.
Uh,
hypothalamic amenorrhea is second.
hypothalamic,
Hypothalamic amenorrhea.
Yeah.
but
Okay.
hypothalamic hypogonadism will be there, no?
There are two things. Wait, I
So
had that. Thing.
okay.
Okay. Whosoever will be taking this, please put it on the group. Okay. I will also put it on the group. Hmm? Now information gathering. What are the important history which you need to? These are the star points to me. Her history of differential diagnosis. Very nicely you took it. Okay. History of weight loss, dietary, her anxieties associated weight. BMI, weight loss, dietary habits, and her views. This is also my star history. This is also my star history. Then signposting, sexual life, sexual desire, her view on fertility, contraception, especially COC, any self harm, family history of similar complaints, and what investigation you are going to order to reach the diagnosis or confirm the diagnosis. Identify cause of amenorrhea, that is WHO type 1, suitable referral in the same, avoid excessive exercise or weight loss for the multidisciplinary management, diagnosis and management to the patient, that is patient safety, starting her on estrogen after BMD reports, or meanwhile also counselor and support group. So this is patient safety. Okay, very important. Applied clinical knowledge, basically diagnosing it as an WHO type 1 amenorrhea, giving her information, management, offer suitable investigation, diagnosis and management. Communication with patient and relatives. So this is basically a lay task. There will be two people, three people, examiner, lay and the patient. So always empathetic towards her approach. Even if patient is saying, expressing her views, do not deny her views. Hmm? You are having a very good command on your communication, so that is wonderful because it was never a judgmental way of communication. Okay, so that non-directional communication. Okay, so perfect communication, allowing her to ask questions, checking her understanding, addressing her concerns, ascertain her views, and respect whatever view she is having. You have to respect, but at the same time, somewhere, somehow, you have to tell her that I do understand that you are feeling that you are not up to, means your weight is not up to the mark and you still wanted to lose your weight, but this is not the case. Excessive weight loss is associated with some ill health. It will affect your bone, it will affect your heart. So that also we need to tell her very firmly. At the same
Mhm.
time respecting her views, but putting our views in front of her, putting what is right for her. That is also communication with patient and relatives. Giving
Yeah.
information in chunks, not using medical jargon, explaining what cause of amenorrhea, offering help, and patient information leaflet. Okay, so this is
Mhm.
all about this task. Very nicely done. Anybody's having any question?
Ma'am, that HH is hypogonadotropic hypogonadism. HA is hypothalamic amenorrhea. HP is hypopituitarism. The table from the dog. That HH is hypogonadotropic hypogonadism.
Gonadism.
Hmm.
HA is hypothalamic amenorrhea. HP is
Okay.
PCOS.
Okay. Okay. Okay, just wait, I'm getting a call. Okay.
So in hypogonadotropic hypogonadism and
Hello.
hypogonadism.
Yeah. Okay.